I'm Dr. Regina Fearmonti. I'm a board-certified plastic surgeon here in San Antonio, Texas. Private practice, I've been here about 11 years. Lipoderma is cryopreserved structural fat, really the first of its kind. We are in plastic and reconstructive surgery talking about a lot of biostimulatory and bioregenerative agents. Patients want things that last long term, and if it's biologic or biologically derived, that really seems to be the sweet spot. You know, we're more into natural and taking care of ourselves. So we have a lot of patients that we're seeing that have lost massive amounts of weight. GLP-1 medications have completely changed the game. So they're seeking volume in their midface, their temples, their body. Up until now, autologous fat grafting, that means we liposuction, we process fat, and we inject fat, has been pretty much the mainstay to replenish fat. In plastic surgery, we kind of live by the motto, replace like with like. So if it's a problem from fat loss, it makes sense to replace it with fat. Up until now, we've had a couple agents at our fingertips. Hyaluronic acid is probably one of the first ones we've heard about. Great for lip plumping, great for instant immediate volume, completely goes away with time. Does nothing regenerative to the soft tissue pocket, and it's not fat. We have other things at our fingertips. We've got calcium hydroxylapatite and poly-l-lactic acid. Those are kind of in the realm of what we call biostimulatory agents. We inject those as well, but they're all about collagen. They build collagen. So having something that replaces fat with fat makes sense. Cryopreserved structural fat, something that's taken from a human donor, minimally manipulated, processed, get rid of all the bad stuff and keep all the good stuff. The good stuff meaning all the growth factors, the things you have in your own fat. That I get right out of a cooler, right out of a syringe, and I can put it right in your face with really minimal processing. Seems to be where it's at. Patients are going crazy for it. If you think about it, we have some models in the office, but if you look at, say, the face, for instance, when you age, you lose fat in your mid-face. You have malar fat pads, your temporal fat pads, and even like your buccal fat pads. So to replace that with a small aliquot of fat, a kind of a placeholder that's going to be quickly revascularized by you and replaced by your own fat, gives patient the most natural result. Lipoderma comes in little cryopreserved vials on dry ice. It's stable in the fridge or just a regular medication freezer as well for months. You basically take it out, thaw it, and just drop the pellet and inject. It's also pH neutral, so there's really not a lot of burning or itching when we place the product. And you know, when you have something that's biologically derived, I mean, you really want to minimally manipulate it. We're required to not do that, in fact. When we take fat from your body after liposuction and process autologous fat grafts, I mean, we can't manipulate that to great degrees. You know, the FDA does not like that. But also we're damaging the fat. You know, the processing cannot damage what we're trying to inject. So having something that you just open and drop into a syringe and inject, you know, again, I just use the term, it makes great biological sense. Patients these days are very educated. They've looked you up online before they've even been in your office. And we do have patients that call and ask for products by name. You know, Lipoderma, Brightside, early story, you know, I think it's on the up and up. But when patients come in for biostimulatory agents and we say, whoa, 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 it's not a collagen story anymore. We actually have something that can address fat loss. We quickly flip them over. They're like, what is this? I haven't heard of this. And it's probably one of the best things that's the least heard of right now. So stay tuned with that. But I would tell, you know, other plastic surgeons that are interested in fat grafting, autologous fat grafting, some of our facial plastic surgeons, you need to try it. I think you will find the ease of use and just the results very similar to autologous fat. I will tell patients that you know, really have exhausted collagen replenishment, you know, collagen stimulation type of injectables, that we have something better.